Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended reporting that their right ear would get blocked every morning. And so after awaking, and it took them about half an hour before they were able to hear anything from this right ear. And upon examination, we can see that this patient's got really dark, sticky glue type of earwax, and they report sleeping on this right side. So what's been going on is that at night, whilst the patient's sleeping, this earwax is acting like glue, and it's sticking the two side canal walls together. And so first thing in the morning when they wake up, it's a complete acoustic seal created by this wax and the sticking together of the front and back canal walls. And after about half an hour, when the patient's, of course, opening and closing their jaw, having breakfast, brushing their teeth, the seal is somewhat broken due to the jaw movements. And so the patient can slightly hear better, but nonetheless, they've noticed that day by day, but week by week, even when the ear does clear, it's not fully clearing, and in fact, it's just getting worse. So they have got quite a narrow entrance to their ear canals, quite a slit appearance. Our ears are oval shaped by design, so it's not circular and round. It's more like an egg shape or American football, so the height is greater than the width. But with this patient, I would say that the height is probably proportionately a lot greater than the width, giving it this slit, narrowed entrance. And you can just see how sticky this earwax is. It's blocking up my suction probe, so I'm just going to put some more medical grade olive oil spray into the ear. And what the olive oil does, it just helps to bind the wax together, so it changes the consistency, and it also helps to lubricate the inside of the suction probe, minimizing blockages occurring. Even there you can see it's slightly blocked, just give it a good shake. The key with this type of wax is not to embed the suction tube too deep into the wax. It's easier said than done. I quite often make that mistake, and because if you embed it too deep, you're just going to block the entrance and going to come out. And we've got a cleaning rod, so if we do experience any blockages, we just remove this suction tube out of the ear, insert the cleaning rod to push through any wax that's stuck inside the suction tube. So these suction tubes are single use. I know there's sometimes people have asked the question. So yeah, they're all single use. We can use them in between the same patient's right and left ear if both ears are non-infected. If you just say this patient's right ear was infected, once we've completed the procedure, we'll have to completely decontaminate all the equipment that we use, and the suction probe we'll have to discard off because it's single use. We put it in the sharps bin. We have a company that comes every month or so to collect all of our sharps for incineration, and we'll use a completely brand new suction probe. Now, in the ear, because the ear is seen as a cul-de-sac, we're not, medically at least, we're not entering the body. You can think about the ear like a belly button. The eardrum is the cul-de-sac. It's the barrier between the outside and inside of the body, and there's no mucosal skin. So when we perform procedures in the ear, the equipment technically doesn't have to be sterile. So the suction tubes themselves don't. This is medically as well. This is if you go to all the governing bodies, the international harmonised standards. But most suction tubes are by default sterilised. All the other instrumentation like ear hooks and Jobson horns, they come non-sterile, and they're single use. Just a bit of a blockage there. So yeah, the right ear is completely clear. This is their left ear. So yeah, they are single use, so you don't reuse them. You can't autoclave those plastics, and the reason why in the UK, I know in America it's slightly different. The mechanical instruments, so the ear hook, Jobson horn, and etc., are typically made out of stainless steel. The reason I feel in the UK they're not, I don't know why, it's a cultural thing. I spoke to an ENT consultant in America about this, but in the UK, audiologists generally use more flexible plastic ones, and that's because you're less likely to cause patient harm and discomfort in comparison to the stainless steel ones. They're obviously a lot more rigid, and so it's more of a patient comfort and safety aspect. So we're just removing some loose hairs. Now, I do know of some people that actually clean their own suction tubes, and you shouldn't be doing that, guys. These are you have to abide by the manufacturer's instructions, and with the suction probes, they're clearly labelled "do not reuse," single use, and these guidelines are put in place by the regulatory bodies as well, especially for suction tubes, because they're class 2A medical devices, so they're not class 1. The suction tubes are a bit more high risk, so you have to have an authorised body to notify and go through all your legislation, all your regulation and documentation, and so it's a bit naughty because you don't want to cross-contaminate. We're big on recycling here. We try to reduce our carbon footprint, but in terms of some medical procedures, and healthcare procedures, you just don't want to risk cross-contaminating between patients. So yeah, we'd recommend not to, as per the manufacturer's guidelines, not to reuse these between patients. So just some sticky keratin there at the back part of the canal wall. The ear canal is quite bendy on this side, as it was in their right ear actually. So we're looking straight into the ear canal, but we can't see the eardrum. The eardrum's veering off to the left. So this is on the cartilage portion of the ear canal. Just in front of it, you can see the ear canal veer off to the left. That's the second bend. Where I am now, that's the first bend. So the region between the first and second bend, we call that an isthmus. It's a narrowing. That's the patient's eardrum, nice and healthy. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.